As she mentioned, I'm Dr. Roseanne Bosch, and I work over at Omaha Children's Clinic. And tonight we're going to talk a little bit about how to get children to sleep. And this is why I like this topic. I have 3 kids. I've been a mom for 22 years. And I have to say, we've had sleep problems. As we mentioned, I actually was a mom before I went to medical school. My son Taylor had a pretty good sleep problem, and it all starts, as most of the stories do, pretty simply. He had terrible reflux when he was a baby. Every time he made any noise at all, we rushed to his side and picked him up and dealt with him all night long. By the time he was about 8 months old, though, he got a little better. Reflux usually does. And he got a little better, started sleeping better, we were relieved. Then I got pregnant with the baby, and I was on bed rest. I had no way, hardly, to take care of an 15, 18-month-old who was running around. So during the day, when it was just he and I, he just crawled up beside me and slept whenever he felt like it. There was no schedule. There was nothing for him. So he really learned to always have me. Then we moved into a smaller place, and we ended up, his crib was in the same room as my bed. He could see me from his crib. He never went to bed without me being the last thing he saw. Of course, he ended up not being able to go to sleep without me. And I don't know how my parents have ended up in that situation for lots of different reasons. I think we all end up in sleep situations for a lot of different reasons. But there are ways to fix it. As I found out when I met Dr. Brett Kuhn, he made my life so much better. He's an associate professor of pediatrics at UNMC down at the Med Center, and he is certified in behavioral sleep medicine. And he's been a godsend to our family because we finally figured out how to fix it, and it was so simple. Now, I grew up in a very big family on a farm. My parents raised 10 kids and 4 cousins, and none of us had a sleep problem. My mother never let us sleep with her. She breastfed every one of them and put them back in their crib. She had other things to do during the day. She didn't have time to monkey around with kids who didn't sleep. If you made a noise in your bed, she did not come to get you. You stayed there till morning. So none of us have a sleep problem, and so for me it was unusual. I was actually the oldest daughter of that bunch. I had never experienced a sleep problem. I didn't know what it was. I didn't know you could have those things. So for me, I really didn't have any basis of how to fix this. But there's a new school here too. I don't think you have to be quite as militant as maybe our parents or our grandparents were. You probably get a lot of advice from them. I think we can teach our children many things. We teach them how to read and write, and how to say please and thank you. But we also teach them to sleep, and that's actually one of the very first things we do teach them how to do. And I think if you have that nurturing, comfortable environment, and make a reasonable schedule for yourself and your child that works, you can all have a good night's rest. Now, when do we worry? Like, when do we fix this? And I think that those are questions that you need to answer. So these are pretty easy. You don't need to fix this. If your child goes to sleep easily, my son did. Your child is well rested during the day. He was. Your child is well behaved during the day. He was. The parents are well rested during the day. That wasn't true. I did not get sleep. He did, but I didn't. And if the parent's relationship is not disturbed by the children's sleep routine, because sometimes it's okay for one parent but not for the other, and it starts to affect the relationship. There are different stages of sleep. These are important to know. This is how my son spent his little youth, waiting for me to be done with bed rest. And you can see he just fell asleep where he fell asleep. It was a very difficult, he slept fine, but it was a very terrible routine. In stage 1, these are the little kids that are just kind of drifting off to sleep. You can see them, their muscles relax. They sometimes jerk a little bit. This actually might be a good time if you're going to have to move a child. We recommend you don't, but if you have to move a child, move them now. Because that one, you might be able to get them to slightly go back to sleep. In stage 2, though, this is not a good time to move a child. In stage 2, they're in a light sleep. You'll notice their breathing's a little bit irregular, but they wake up like this. The problem with stage 1 is they're not quite asleep, so they wake up a little bit and go right back to sleep. In stage 2, they are sleeping, and if you wake them up, they'll wake up entirely, and then you're back to square one. Stage 3 is a pretty deep sleep. They're difficult to wake up. This is when you see things like, and I don't know if you've experienced this with sleep terrors, bedwetting. Sleep talking, sleepwalking. This is when these things start because they're not really awake when those things happen. If you've ever had a child with sleep terrors, you realize that you can't really wake them up. Stage 4, now this is where those two were at the time. A deep sleep, no eye, no muscle movement. They're groggy if you try to wake them up. As you can see, I managed, this was an early morning, I managed to put their entire clothes on, coats, boots, everything. They never woke up. That's stage 4. That you can move a child in and they won't wake back up. REM sleep is our dreaming sleep. You might wake up easily and they might not. So it's difficult to say, can you move them at that point? No muscle movement. You usually have irregular breathing, much like stage 3. But they have these rapid eye movements, and you'll see their little eyes moving underneath their eyelids. And this is when kids have nightmares. So it's just a little more difficult. You just don't know what you're going to get if you move someone in this stage. So where do we go from here? Everybody's child's different. Every child has a different issue going on, different ages. We talked about some people here have teenagers, some people have newborns or even unborns, and some people have 2-year-olds. It's completely different. So what you need to do is log your child's sleep, what they're doing now, because we need to know what they're doing now so we know how to fix it. So for about a week, clock it. Find out exactly what they're doing. Include the naps, even if they fall asleep in the car when you're driving them to the babysitters or driving them home. And on weekends, and that's especially true for teenagers, because if anyone's ever had a teenager, they'll be sleep deprived for 5 days and then sleep solid for 2. And they'll sleep till noon or 2 o'clock if you don't wake them up. They're trying to catch up. They really can't, but they try. So you really need to know what's going on with your particular child. And what you specifically need to know is you need to figure out what that hour is that they actually fall asleep. If you put them in bed at 8 o'clock, but they're not in bed till 10 o'clock is the time they fall asleep. So kind of try to figure out where you're at. And that might be especially true of a teenager. You might send them to their room at 9 o'clock at night. They're not in bed. They're not sleeping till 2 a.m. And you need to know what you're dealing with there. And now there's actually a table that's on the next slide. You need to find what typically, because every person is different, but certainly there's a typical amount of time that someone needs to sleep. And those charts are actually included in the slides. And then we want you to write a schedule of what would work for you. Like at what time of the day do you all need to get up in the morning, backtrack to when they need to be in bed at night, what time naps would fit into schedules depending on when you're taking them to daycare or when you're home, and try to figure out hours-wise at least, what do we really need here? Now, these are the sleep requirements for different ages. As you can see, it changes quite a bit. And that 1 week to 1 month is hard to say because all they do is eat and sleep, pretty much. And so it's hard to say. But when they get here to the older months, you can see that maybe they need 3 naps, drops down to 2 naps, drops down to 1 nap. By the time someone's 3, many of the children don't actually need a nap. It depends on some days they need one, some days they don't. And that gets a little bit tricky. If they play really, really hard, a 3-year-old might need a nap. But for the most part, you hit 4 years old and most of them don't need naps. Which is interesting because when I was in kindergarten, they made us take a nap. I was never tired, and that's probably why. And then you get over here into this is also interesting, I think. In these school age years between 6 and 12, they need anywhere from 11 to almost 10 hours of sleep. And there's very few of our kids, when we talk to them in clinic, that are actually getting that. The parents need to get them in bed earlier than what they're getting. And then look at those teenagers. They still need 9 hours of sleep. A lot of teenagers think they can get by with 5 or 6 or 7. And our studies would all say that's not true. They need closer to 9 to really function and do their best. That is difficult to convince a teenager, but now you've got a slide that says so. Now for the new schedule for teens, and we talked about this is difficult because if your teenager is really off by more than 5 hours, say if you go by that 9-hour schedule and you say they have to get up at the latest at 7 because they have to be at school at 8, and you backtrack, they need to be in bed at, say, 9 o'clock? If they're right now currently not going to bed until 2 a.m., they're off. They're off a lot. And sometimes it happens over summer. We see that a lot in the summertime. They just kind of have no schedule, and they go to bed at midnight and sleep till noon every single day. And then they hit school, and most of schools, at least here, the high school, start at 8 a.m., and I know our junior high starts at 8 a.m. So you go to this schedule, and if they're more than 5 hours off, you need to do this on a weekend because you can't do this during the school day or school week. If they're more than 5 hours off, you actually have to set their clock forward. You're saying forward. You're not putting them to bed earlier. You're actually putting them to bed later. So you try to keep them up. So you keep them later, 3 hours later, every single night until they're not sleeping, and then you put them to bed at the time you want them to go to bed. So you're basically making them sleep deprived. So you want to do this, if you're doing this for a teenager, it's difficult because if they're working or they're driving or something like that, it's a little tricky. You want to pick a weekend where they're not working, they're not driving anywhere, and you can do something like this to push them ahead. If you're pulling them back a half an hour each night, it can take a long time to get 5 hours. It could take you weeks. If someone is, though, involved in lots of things and they're driving and they're working, you might not be able to push them forward. But that would be the fastest, easiest way to do it. Make them so sleep deprived that they will go to bed for you at 9 o'clock at night. And they'll be tired. Now, again, this is the hardest thing for us. And my two youngest ones are now almost 13 and 15. And they would sleep in every weekend if I let them. And this is difficult because really once you've got the schedule established and they're going to bed for you at 9 and getting up at 7, to maintain that, you can't really let them get too far off on the weekends. So you almost have to go in there at 9 o'clock in the morning on a weekend and start getting them up, having reasons for them to get up and get going. Because if you let them get off too far, they're not going to be able to maintain it during the week. Now, ideal routines. This to me is an ideal routine. And I think it should be pleasant, pleasant interactions between everybody, pleasant environment. I think that's really important. And most of us try to make a nice, cozy bedtime routine for our children. And this is the hard part. It needs to remain in place all night. And we'll get to why that's so important. Now, these are normal sleep associations. We talk about sleep associations because there's also ones that you don't want to have. These are normal ones. Say, you're an adult, you probably eat, shower, and you lock the house doors and set the alarm clock, read a few pages of a book maybe, kiss your spouse goodnight, set your glasses on the nightstand, and you turn the lights off. You go to bed. Now, if you wake up in the middle of the night, you look around, everything's the same, great, you go back to sleep. That's normal. That's normal sleep, and that's what we're trying to kind of approximate for your children. Now, imagine if you woke up at night and things weren't the same. Say that you fell asleep in the living room and now you're in your room, or vice versa, or your spouse is not there, or the door was open and you left it closed, or the lights from your alarm clock are off and you're wondering, did the power go out? What's going on here? You wake up even further and you try to reestablish the exact conditions that you went to sleep at. You'll go and fix the alarm clock, find the spouse, you'll make it all exactly the same as the way you went to bed every night. That's normal. And this is sometimes what our children are trying to do. They're trying to reestablish the way they went to bed. So that's why the way they go to bed is really, really important. So, for instance, my son, if he could see me, he was okay. He needed to reestablish that there's my mom, I'm okay, I can go back to sleep. That became really a big issue when he got to be 2 and could get out of his crib by himself, because we hadn't fixed it yet. Now, an ideal routine too is calm. So if you're talking about good, pleasant interactions, no scary stories, no scary movies. This is probably pretty obvious, but sometimes some stories that I think that shouldn't be scary are. It depends on the child. Wrestling. No wrestling and tickling it right before bed. No TV, no video games. All of those really stimulate our minds. Quiet. So this is tough for our teenagers. No music, TV. Those actually keep your brain in gear. They also do something else. It's light. It stimulates your brain to stay awake. Any light will do that. So any noise and any light will stimulate your brain to stay awake. So we like it absolutely silent and no as little light as possible. Now, for some people, they're never going to get away from that little tiny night light. That's probably okay. But if they're using a 60-watt bulb and they can't shut the lights off, then we need to work on that. Because that will continually keep them awake. Safe, of course, because for all children, no cords, outlets, water, candles. You need to know that they're safe in their room. This becomes an issue perhaps if you need to use a gate. If your child is old enough, like my son was, to get out of his crib and come and find you, you may need to use a gate in his doorway. You may need to use one on top of the other, too, if they're a climber. That's something we'll talk about again later, but you need to make sure that they're safe. Quick, again, needs to be short and to the point as much as possible. So when you're making your ideal routine, keep in mind, okay, 10 minutes. For a small child, 10 minutes. That's all the longer their attention span is in anyway. So 10 minutes is fine for a 2-year-old, 4-year-old. 30 minutes is probably more for a teenager who might have to shower and, maybe, check one more thing before they go to bed. It needs to be easily reproducible. So it needs to be something that you can do at the daycare, at grandma's, at a hotel. It has to be something that you can, and portable. We talk about that too. It needs to be portable. And I say that because my oldest decided to get a really big toy and a really big book that she fell in love with and a really big blanket. And guess what? When you're running through the Salt Lake City airport and you've got all of this and a child and some luggage, it's really not very fun. So I highly recommend that when you give them their choices of things that they want to become attached to, keep it small, washable, and portable. It'd be so much easier if you just had this. Got the little stuffed animal, little cute book in here. It's got the little blankie. This comes with you, goes anywhere. Easy to run through the airport with. So think about that when you're allowing them to choose. If you don't even have this as a choice, they can't choose it. Only give them choices that make sense in your ideal routine. Portable and small and washable. And safe. Make sure that that toy is safe, that it doesn't have, these eyes can come off. You want something that's really, truly safe for them at night. Now, in your ideal routine, you want to end that routine in your child's room. And the reason that's so important is they need to be in their, tucked in by themselves, not with anyone else, and not sucking on any pacifiers or bottles. So you really want them a little bit sleepy. They've got their happy little 10-minute routine or 30-minute routine, and then they go to bed by themselves in their room. And the reason we say that is because when they wake up in the middle of the night, which we all do, they need to see it exactly the same conditions as the way they went to bed. And that calms them. They're like, oh, everything's the same. I'm okay. I can go back to sleep now, just like we do. Now, if your child falls asleep somewhere else and doing something else or with someone else, that's their happy routine, and they're going to go try to find it. If it's 2 o'clock in the morning or 4 o'clock in the morning and they wake up, they want to reestablish those original sleep conditions. So you want to make sure that your pleasant little routine ends in the room by themselves with very little stuff to go along with it. Now, the difficult sleep associations that we talked about. See, this is where we have our problem. Pacifiers, bottles, and breastfeeding. Now, it's okay to breastfeed your baby, but make sure they're still awake when they go to bed. They're not actually falling asleep at the breast. Keep them awake a little bit. Put them in their crib. Put the little light blanket over them, and say goodnight and walk out. You want them to not actually fall asleep to that bottle or fall asleep to the breast or fall asleep with a pacifier in their mouth. There is a new study, though, saying that pacifiers might actually help in the reduction of sudden infant death syndrome. It's one study, and it goes up to 6 months of age. So I would say, okay, the pacifier, maybe if you're 6 months or under. But once you're 6 months old, I would recommend you actually throw the pacifier away entirely. That's when their teeth come in. That's when they start to attach to things. They attach to things. And you don't want to be the one who has to go in there every 2 hours and put the pacifier back in their mouth because they can't find it. So if they get to be 6 months old, I would throw it away as fast as possible. And then, if they have to be rocked to sleep again, when they wake up and no one's rocking them, they're going to come and try to find that again, or they'll cry until you bring it to them. Falling asleep in another room or bed is a problem. Falling asleep to TV, music, activity. And some of our teenagers will say, oh, I fall asleep better to music. But that's a problem again. Music keeps their mind awake, and they need to reproduce it to fall back asleep sometimes. Most of our teenagers sleep pretty well, but sometimes they do. parents, siblings, or pets as blankies. So that's where we were falling into trouble. Is I was his security blanket. He had to be able to see me, touch me, have me there when he was sleeping or when he was falling to sleep. He slept great after that, but he had to know I was there, and that was a real big issue. And there's some kids who get attached to a sibling, which can be an issue. And so you don't want to transfer their need for you to a sibling, because it's not fair to that sibling. That sibling is not going to sleep as well. They're going to have the same problems that you were having. So don't say, well, you can go sleep with your sister. It's really not fair to the sister. And then pets. Again, not fair to the dogs and cats and stuff. We had one family who told us that, yeah, their son had to have the golden retriever on the end of his bed. And every time that golden retriever moved, which you could feel it move because it's huge, the kid would get up and try to go find the golden retriever and make the golden retriever come back and lay on the bed. And of course, this poor pet was just beside himself. He was unhappy. He didn't want to stay there all night. And then, so don't use the siblings or pets as a substitution for you either. And of course, those bright lights. If someone has to have every light on in the house, you've got problems. And there's ways to kind of work on all of those things. Now, so you have to figure out what is your child's association. Like, what does he have to have or she have to go to sleep? Is it the TV, pacifier bottle? Is it the parent? It's just one more story. I don't know if you hear that. One more story. Or being rocked. And you know it's an association when as soon as you give them that, they go right back to sleep and sleep fine. That's an association. And you have to decide, is this a good association or is it one that's causing trouble? Now we want to write out your dream routine. My daughter thought that was funny. Write out this dream routine with your spouse. Get people involved who are going to be working with trying to put your child to sleep. Everyone really needs to be on the same boat. Let the child choose one story and make it short. Make it fit into your timeline that you've chosen. And a toy. If they're older, if they're over 3, they can pick their own. But again, only give them choices that would be acceptable. You can put out 3 very small books and say, which one do you want to be your book tonight? They only get one, and it's all small and short. You don't give them the encyclopedia of dinosaurs. It's taking too long. And the same with the toys. You only give them a choice of the small ones, the ones you can fit in your purse or your diaper bag. You don't give them the choice of the big one. It's not even a choice. And for some people, and I think this is one of the reasons why my daughter did not have a sleep problem, she was a very sociable person, and she adopted one of these little toys right off the bat. By the time she was like a year, she had her sleep toy. She had already chosen it. It was small. She still has it today, and she's almost 13. She probably wouldn't like me saying that. But she has her little sleep toy, and it goes everywhere. It fits in a backpack, fits on the plane. It goes to grandma's, whatever. But it's small, and I think that's the reason she chose, of her own accord, a sleep association that worked. My son chose one that didn't. Now, again, short routines. Start on a long weekend with normal nights. And if there's one parent who just cannot deal with this, they can go stay somewhere else for 2 or 3 days while you establish the routine. But it's really easier if you can get everyone to work on it together. But if someone just can't handle the chaos that might ensue, then they just need to go somewhere else while you establish a routine. And then when they come back, they need to be on board and also do the same routine. It's so important to have it always the same. Then the kids can depend on it and count on it. If the child is over 3, you might want to discuss the routine with them. It's basically like giving them a new deal. That's what Dr. Kroon called it, a new deal. You may have to move the furniture in their room around and say, okay, tonight it's new. And they can see that. They look, their bed's in a different place, everything's different, and this is going to be a new deal. Sometimes telling them this is all new is great. If you happen to be moving to a new apartment or something like that, a great time to start it. Just say, in this house, this is what we do. And it's just a real easy way to transition to say, it's different now. It's a new deal. So you can tell your child over 3 that this is going to be a new deal. This is how we're going to sleep now. And make a reward system for those kids. Probably a small daily prize and for doing what you ask, and then a big weekly prize. And I don't mean big, I mean like maybe an extra story once a week or something like that. I mean, it doesn't have to cost you money. It can be you get to go to the park tomorrow with mom. It can be something that doesn't cost you anything, and it doesn't have to be huge. It just needs to be a reward, and they need to be happy with it. Even if it's just you get to sit in the big chair for supper tonight or something. It can be really, really something simple for kids that are that young. For older kids, it might have to be a little bit more. Teenagers are tough. You can offer them rewards and you can take away. So you have a couple of options there. And probably school-aged kids, the kids who are between 6 and 10, you want to discuss it with them, obviously, because they have to be on board with it. And they can make a couple of choices. Prizes and stuff are a little harder in that age, but certainly there's got to be something that they would be happy with. If it's going to a movie on Saturday matinee, so we don't mess up their sleep routine. But it can be something or even rent a movie. Say, okay, you get to rent a movie on Saturday if you do this right all week. It can be something not huge, but something that is still a reward that they've earned. Now, when we start this new routine, again, remember we were going to figure out what time they actually fell asleep, because that's really what's important. They need to be tired when we're asking them to fall asleep. So that's when we start the new routine. We say, okay, you went to bed at 10. We want you to go to bed at 8, but you went to bed at 10. That's when you fell asleep. So we're going to start the routine at 10. And we're going to make it short. We're going to have it 10 minutes. And then, because they're already kind of tired. They're kind of tired. They should be if they normally fall asleep then. So you put them in bed, do your little routine, make it quick. They fall asleep in their room. And then you let them sleep that full 9 hours or 10 hours or whatever you determine is the right amount of time. You actually need to wake them up. This is where you're going to kind of sleep deprive the little kids too. You wake them up at the new time you want to wake up. So actually it would be shorter than that. It might be 7 hours. So they're a little tired. Then you keep them up until your new decided nap time. And then adjust that bedtime. Every night you back it off 15 minutes, half an hour, something like that, until eventually you're going to reach that desired bedtime. It may take you a week to do this, but you certainly want to start out when you're first sleep depriving them. You probably want to start out on a weekend. This is probably really important. If you're way off, some kids have no schedule like my son did, and some people are just way off. You might need to reset the nap times and meal times, because most kids eat their meal and they go take a nap. So if you're very far off and you're going to be having to back up by 2-3 hours, you're also going to have to slowly back off nap times and meal times too, to kind of give them, to set them back. Because for many younger children especially, their meal times and nap times are coincide. Now, teenagers, again, I find this difficult because I've already raised one teenager and I've got 2 more. So, and I thought they were hard when they were little, This is hard because my kids have suddenly decided they need to email their friends at 10 o'clock at night. And my thought is, and why are your friends emailing you at 10 o'clock at night? So we get into some very good discussions at my house. And it usually involves, stop now or it's mine. And that's kind of how you have to do it. You need to unplug these teenagers. They will stay up as long as they can because their biological clock is telling them to stay up till midnight. That's what their clock wants to do. Almost every teenager will tell you, I'm not tired till midnight. That's a problem when school starts at 8. They cannot survive on 7 hours of sleep. They can't do well in school and do well in their lives if they stay up until midnight every night and get up at 7 to get to school by 8. They can't do it. So in the end, we have to be almost tougher parents than we were when they were 2. You need to just say, TV goes off. And if they don't shut it off, you say, shut that off. They don't shut it, you walk over there and you shut it off for them. It's really it's that tough and it's that simple. You walk over, you shut it off. Some parents go to the point where if they've got kids who are sneaking onto the computers late at night, all the computers go into their room. It was easy when the computer was only in one room, but now, we've got wireless everything. So those computers could be anywhere in the house, probably outside on the deck and still work. So if you've got teenagers who just won't give that up, then they need to give it to you at like 8 o'clock at night. You get the computer, it goes in your room. They'd have to sneak past you to get the computer. And hopefully your teenagers are a little more compliant than that. Some aren't. Telephones and music too. Sometimes you have to pretty much make them media-less. They just cannot have those things in their room if they can't control those things. It's difficult to get any teenager in bed at 9, but according to what we're saying here, that's when they should be going to bed. Very difficult. And remember that all of those things up there, the TV, computers, phones, they're all really activities that are earned. It's not a right as a teenager. They think it is. It's a right to have a computer, a right to have access to their friends. It's really not. It's something they earn. And they might be able to earn them back. If they're really being non-compliant, you just take all that stuff, it goes in your room, and they can earn them back by doing what you're asking one at a time. So you can do that too. It's hard to be that tough on a teenager, especially if you otherwise like them. I like my teenagers, but the bedtime gets a little sticky. Turn all of them off about an hour before you went. So really you should turn them off at 8 if you want them in bed at 9. Because they still have to get showers, get ready, get their school stuff packed, pick out clothes for tomorrow, all that kind of stuff, which might take more than half an hour, but certainly a half hour before bedtime you need to shut those things off. And we say an hour because that light from all of those things and the noise from all those things keeps your brain awake. You need about an hour to just kind of start to shut off and relax and get ready for bed. And this would be true of parents. All these things we're talking about teenagers, this is true of us as well. We're not quite as much night owls, some of us might be though, but as teenagers are, but certainly same for us. If we want to go to bed at a set time, we really need to be thinking about shutting all those things off an hour before we need to go to bed. Because certainly we need at least 8 hours of sleep ourselves. In the morning, wake them up, the reverse. You can wake them up with all these things that you've taken away from them before. Maybe then they need to email their parent or their friends at 6:30 in the morning. I doubt they would, but this is when you can walk into the room, flip the lights on, open the shades, hey, get up, start the music, TV, turn the TV. I turn the TV on and watch the news in the morning, and I turn it on pretty loud. And that's my reason. I have 2 teenagers in the house. I think they should hear the news too, but we just want to be sure that they're awake. And bacon works really well for my son. If he can smell breakfast cooking, he'll get up. So, it depends on what gets your kids going in the morning. Teenagers are a little tough though. It really is. I feel like I'm having to be more strict than I probably was when they were younger. Now, some new associations. Again, we talked about putting them down a little bit sleepy, but a little bit awake, and without that difficult association. And it's your job to reassure them. It's not your job to make them go to sleep. It's only your job to reassure them, and that's the difference. I always thought that I had to make sure they were sleeping. That's not the key here. So you check in on them at increasing intervals, and we say it's your choice. If you want to go in there at 5 minutes, you walk in at 5 minutes, you lay them back down, put their little blanket on, pat them on the head and say good night and walk out. 1 to 2 minutes of reassuring, that's enough. It's just to say, I love you, I'm here, I am in the house somewhere, but I don't have to stand here and watch you go to sleep or make you go to sleep. Continue that, and you can go adding like 5 minutes up to probably 30 minutes. So at 30 minutes, then you only have to get up every half hour and go check on them for a couple minutes, put them back down, lay them back down. And then you continue that until if they do this all night, I hope they don't, but if they do this all night long, when you're about an hour from when you would have woken them up anyway, wake them up. Just keep them up, and keep them up till the new nap time. Again, they'll be more sleep deprived. So will you, but they'll be more sleep deprived. And this is hard. Never reverse the timing on this. If you went in at 5 minutes and then at 10 and then at 15, 20, up to 30, and then and kids who can talk to you and yell at you and say things are tough because they could give you a blood-curdling scream, and you want to go in there before the half hour. Certainly you can peek in the door, make sure they're okay, but you don't want to go back in sooner. And the reason is because you get this, what we call the Las Vegas effect. Unfortunately, we are human beings, and we all understand that if you suddenly get a big payout that's random, you will up the ante. every single time. And it's something that they've been able to see in lots of different human interactions, and it's certainly true in this one, especially with children. If they know that, well, if I do just a little bit more next time, they'll be running in here. And so you need to avoid that Las Vegas effect. It's time. They will quit. If you never get a payout, people quit gambling. If you never get a payout on this, they'll stop waking you up. They'll go to sleep. So remember that Las Vegas thing. Don't go in there sooner. There's maybe one time when, and it's mentioned in some of the books, one time where you might have to. Here and there you get someone who likes to vomit to get your attention. You may have to go in there sooner. If you go in and that's happened, you just clean them up, put them back in bed, you go back out, and you do not come in there for another half hour. But you may have to clean them up, but don't talk to them. Don't say anything to them. Just be like, I'm the maid here. Take care of it and leave. That's probably the one time where you might have to go in there sooner. Or if they, well, hopefully you've made it safe enough that they're not ever in danger. But if they really appear to be in danger, you might have to go in. Now, this is another method, and this is, I guess, maybe a little softer method. I personally think it's too soft, but you can. I mean, some of our sleep experts have mentioned this. Another method, you sit in a chair, you're in the child's room, especially if you have one who's associated to you like I had. Sit in the room, and then each night your chair gets a little further away until you're out the door and around the corner. I think, to me, that takes way too long, and I think it confuses the children. Myself, I think it would confuse them. That might be helpful in some children who really do have anxiety, and we talk about that later. And again, don't give in. We don't want this Las Vegas thing going on. Another method suggests that you can, one of the other books said that you can do that only once a night. So you only have to do it as they're falling asleep. That once they've slept once and they wake back up, you don't have to do all that again. You can just go in there, reassure them for a minute or two and walk out. But if they really have a strong attachment to a parent and seem to have some anxiety along with it, that might be the method that you'd end up going to. Now, again, we talked about needing a gate, or maybe two, if your child likes to get out. That was the problem that we had with, by the time we decided we should do something about this, Taylor was 2 years old. He could climb out of anything. So it ended up being an issue, and had I known that I could have just put a gate up, I would have done that. If I could have just stuck a couple gates up there. For some children, depending on what their room is like, if they can crawl out of their crib, they shouldn't be in a crib, first of all, because they can hurt themselves. Now, if you have someone who you really are concerned that they're going to bang their head against something or throw things around, those are the children where you take everything out of the room, you put in a mattress, a nice blanket, and 2 gates by the door. And they have nothing to throw, if they throw the blanket out, they just don't get it back. And I've seen kids that we've had to go that far on, but most of them you don't. Eventually they'll get tired of it. It becomes a game they can't win, and they'll go to sleep for you. But again, if your child is talented and can unlock the gate, which I never did this with my son, but my guess is he could have. He's a MacGyver, still is. He can fix anything. By the time he was 18 months, he was taking screws out of everything in my house. And I was lucky, I always found them right by the thing he took them out of, or in his pocket. So he was taking things apart by the time he was 18 months old. So by the time I wanted to fix his sleep problem, he might have been able to take the gate apart. I don't know. But if you've got one of those really crafty kids, it ends up being a safety hazard. You may have to hold the door shut, and that requires a lot of work on your part. And you can hold it for increasing intervals. Again, kind of like leaving the room. It's kind of the same. You hold it. But don't lock the child's door, because in a serious problem like a fire, they would not be able to get out, and that would be a serious safety hazard. And the same kind of goes with locking your door. And I toyed with that. I thought, well, if I just lock my door, he can't get to me. But the problem is he could get to the whole rest of the house. He could get outside. He could get down the street. So because he was MacGyver, and I knew that about him. So I knew that for him, that would be a serious safety risk, and so I never did that. I kind of just let it go longer because I was unsure of how to fix this. Trying to figure out, it was easier to just let him sleep with us, than to figure out what to do. And we talk about that again later too. Night feedings, at 3 months, your baby probably only needs to be fed once at night. So if you need to go in and reassure them but don't feed them, you can do that, and then just feed them the one time. At 5 months, they actually don't need to feed. They will feed plenty during the day. They're just waking up to see you. They like you, which is a very good thing. They like their parents. They really don't need to eat. They might think they do, but they don't. What you need to do is if they're only taking a few sips, you just don't feed them. You go in and reassure them, put them back to bed and say, love you, go to bed and walk out. If your child is 5 months and is actually feeding, I met a patient today who said, yes, her daughter was drinking 4 to 6 ounces at night. And I said, well, we can fix that too. You just reduce that, 1 ounce or 2 every night. So if they're only drinking 4 or 5 ounces, in 5 days you can be down to nothing. So you can fix it pretty fast, and then you can just reassure. Now breastfeeding is a little different because you don't really know how much they're getting. If you're breastfeeding your child and they're getting up a lot, you could decrease the time. I think they are nursing for 20 minutes. They get 15, they get 10, they get 5, they get 2, they get nothing. So you could decrease the breastfeeding as well, but you have to go by time because you don't know how much they're really drinking. Now, pacifier use, again, we've talked about this, that there is a study saying that maybe up to 6 months it's okay to give someone a pacifier. And I don't have any real problem with giving a baby a pacifier until they get teeth. And the other thing to know is that at about that 6 months is when they start to attach to things, meaning they can go get it if they want to. They might start to crawl and to move, and they can get attached to something. So at that point, when it's no longer helpful for sudden infant death and they don't need it to calm themselves and go to sleep, that's the time to take it away. So at 6 months, I would take them away. But if you happen to have an older child who is using that pacifier still, and we meet 2 and 3 year olds who still have pacifiers, it's probably hard on their teeth. So we would recommend that you take it away slowly. Do it at nighttime only for a week or 2. Saying, okay, you have to. Some parents make a game of it. The child has to throw it back in their bed. Okay, throw it back in the bed. Okay, it stays there. That's where it stays at night. It sleeps there. So they leave the pacifier sleeping in the crib. And then after 2 to 4 weeks, you can eventually just stop the pacifier entirely. Again, probably easier said than done, and it's hard to be tough sometimes when that pacifier would make them go to sleep. The problem is if every 2 hours you have to go back in there and give them their pacifier back for you to get sleep and for them to get sleep, you've got a problem with the association to the pacifier. If they only need it to fall asleep and they never need it again all night, it's probably time to take it away. They probably don't really need it. Now, parent associations, we talked about this. At 12 to 18 months, you need to give that child something special. Like I said, my daughter did pick something nice and easy. That's what you want to do. Give them a choice of 2 or 3 things. And if they don't care about it, that's okay. It's because you can make them care about it. Meaning, oh, where's your little puppy? Oh, there it is. And you just give it to them. So you can choose it for them. If they're not interested, that's okay. You can make them interested. You can just give them, that's their special sleep toy. And again, small, safe, portable, washable, and don't use a sibling or a pet because it's very annoying to that other person or pet. Anxiety. Now, that's the question. They say, they can say anything. I'm scared. I'm scared, Mommy. I had a bad dream, Mommy. They can say a lot of different things. It's hard to differentiate. Is this real? What's going on? If they claim nightmares every single night, it's probably not a nightmare. It's probably anxiety. If they're not really awake, if you go in there, they're just screaming or thrashing around, you go in there and you try to get them awake, and they actually thrash around more and seem more distressed and don't seem to notice if you're there in the room. That's probably a night terror. That happens in a certain sleep stage. We talk about this again later on another slide. If they have daytime anxiety, if your child is anxious all day long, they probably actually need professional counseling. And I don't mean that I mean that they need behavioral modification. There are some children who really do have anxiety problems, and anxiety does not necessarily need to be medicated, but it needs to be talked through. They need to have different personal resources of how to deal with things that upset them. And those can be taught in counseling sessions. If they're only 9 to 18 months old, they may have separation anxiety. It's something that we see. This is normal. This is just your child figuring out that, oh, I'm different than my mom or dad. They're a different person. And they realize that when you go away, they have an object permanence. What they see is what they know. So when you go away, they think that you're not coming back. And that's okay, because it takes a few months for them to figure out, or weeks, that you really do indeed come back every time. And that's just a learning process, and it has to be gone through. Everybody goes through it when they're very small. And it's okay. That's normal. You might notice that when you drop them off at daycare, all of a sudden where they were happy, they're now having some anxiety or issues. But if you ask the daycare provider, I bet in 5 minutes after you leave, they're fine. They're just trying to figure out, are you coming back? It's an object permanence issue. So don't give it much credence. You put them in bed. If they're 9 to 18 months and they are upset that you walk away, they probably actually should be, because they're learning something. Just walk away. If it's a major life event, again, sometimes if you have a birth of a new sibling, or you have a parent who's no longer in the house, or you move to a new house, you may need to just reset everything and give that child just this is a new deal, this is the way we're going to do it now. Now, for treating nighttime anxiety, you need to build a level of trust with your child. If you need to check on them periodically as they're falling to sleep. So you agree to your child, say, you stay in your room and I will check on you every 5 minutes until you fall asleep. You don't need to sit by them, you don't need to hold their hand, but you will check on them, just to reassure them and build a level of trust. You also can agree to protect them, say that if anything happens, I will come and get you. If anything happens, I will come and protect you. So they know that you're really going to be there for them. And you need to end that pleasant routine, again, like we talked about, in the child's room. They need to think that their room is a very happy place. If they believe their room is a happy place, that'll decrease their anxiety level. Again, the door open or closed, generally we let the children decide for that, because one might make them anxious and one might not. Some of it, though depends on whether you have pets that might be able to come and go, that's distracting, or if you have siblings who might come and go, that's distracting. So then you might have to keep them closed, but if you can give them a choice, give them a choice. They also might need rewards for staying in the room, not waking everyone else. Not yelling out in the middle of the night for their parents. That when they wake up and they feel frightened, they should grab their little sleep association toy, and or some people, I don't know, some people it's a small flashlight, but that depends on the age of the child. A flashlight would be dangerous in some age groups, but for some it's just knowing that they can turn it on if they have to, if they want to. And this is for kids who are extremely anxious. Again, sometimes a very small nightlight does help, because when they wake up, they can look around the room and see that everything's the same. The same conditions are there as when they fell asleep. So for some children, that's actually very helpful. But I wouldn't go very large. If you have someone who has, and I don't think I addressed this in the slides, if you have someone who has to have the light on, what you do is you first start to replace that light bulb with a smaller and smaller bulb, until you're down to maybe a 25-watt bulb. If you do that slowly, your child might not even know it, depending on their age, that you're going slower. And then go to lamps, and again, smaller and smaller, and hopefully get to just a small nightlight. I'm okay with a small nightlight, as long as it's in a place where the child can't hurt themselves. Partial awakenings. We talked about these. These are the things like sleepwalking, sleep talking. You can also call them confusional arousal. Some kids are just confused and they go right back to bed. They don't seem terror. They just are confused. And it happens about an hour or two after they go to bed. It's at the end of stage 4, when they're either going into REM sleep or going back into stage 3. So there's a change in the stages of sleep. This might also actually be inherited. If you have a parent or a sibling who had problems with these things, your child might as well. It's something they usually outgrow. Now, the sleep terrors and sleepwalking, usually you can't wake them up. They actually seem more combative if you try to intervene. And again, what can we do for these children? some things. You can make sure that they have a normal sleep routine. It helps a lot for them to have normal daytime routines and normal sleep routines. You'll notice if you have a child like this that they're worse or more often if they've had a chaotic day or there's been something different, big birthday party, or they went to grandma's house where there's something very different than what they normally do. They're more prone to the night terrors or sleep talking or sleepwalking. It can also be worsened by, of course, illnesses and medicines that they might be taking. Or forgot to take, and of course by any chaos. And the associations can actually be a problem. If your child has an association where they need to wake up every night and come and find you, or come and find something, or go turn the TV back on, that actually promotes that change from stage 4 to stage 3. If they have a sleep association, they're more likely to actually, in that transition period of trying to go reestablish the original conditions, to find that association of having a problem with the sleepwalking or the sleep terrors. Bedwetting, also, again, may be inherited. So if you had a parent who had problems with that, and we say it's actually can be normal up to the age of 10. So if they're otherwise healthy and have no other issues, we don't really do much about it. You don't have to. The things you can do, you can reward them for dry nights, but please don't punish them, because for most of the kids, they actually are unable to control this. Some things you can do is try to help them hold their urine longer during the day. And by this I mean have them drink a whole bunch of water and then see how long they can wait to go to the bathroom. Sometimes it helps to just train the bladder. But for some kids, this isn't really the problem. For some it is. You can also do sensor devices. Maybe you've seen little bed alarms and things. They have, they call potty pagers and bed alarms that will wake the child up if they get wet. It helps somewhat in that the child learns to arouse, to wake up, and maybe go to the bathroom before that happens. But for some children, if they're actually unable to hold it, it doesn't do any good. The alarm starts after they've had a problem, not before. And the other thing you can do, these tend to happen, like I said, 1 to 2 hours into the night. So if you wake your child up about 90 minutes after they go to bed, just have them urinate and go back to bed. You may end up with a dry bed, but the child has not learned anything by it. But if it's becoming a real problem for you, especially if you have a parent who goes to bed later than the child, it's easy enough to just get them up, have them go to the bathroom, and then go back to bed. But again, it doesn't stop the problem. There were medicines that we used for this, but some of them have lost their indication in children. Co-sleeping, again, this is the question. Is it okay if they sleep with you? Well, it's hard for me, knowing children who've died of SIDS, it's hard for me to say it's okay, but on the other hand, there's lots and lots of literature that would say it does not increase the risk. So it has to be a mutual decision for both the parents. If one person's okay with it, but the other one's not, it's not going to work for you. And the question is it a reactive decision? That's what it was for us. I just got tired of being tired, so I just left him sleep with me. And in the end, it wasn't probably the right decision, but it was a reactive decision. And again, if there's any reason not to, like, for instance, if the parent snores, they may have a problem with sleep apnea, so that's a problem. If they actually have a diagnosis of sleep apnea, if they drink alcohol, take medications that might make them sleepy, and that even includes any of the antihistamines that you might use, which this time of year, there's probably a lot of people taking those. If you have those conditions in one of the parents, you really should never sleep with your children because you might be too groggy to realize that they're there. And the other thing is to always remember that children can get trapped in the adult bedding. That's maybe one of the other big issues. It's not just the fact that the adult is there, that you have big thick comforters and big pillows and things like that you would not have in a child's crib. So they can get underneath the comforters and pillows, the parents, and even trapped against the walls, and we've seen that. So it's really hard for me as a physician because I've seen children who've had trouble with this, who've actually died or had brain damage from this. So it's hard for me to recommend it's okay, but it's hard also to imagine that someone who's 2 or 3 would have this happen. But I would say for most of us, by the time our kids are 2 or 3, we don't want them in there anyway because they're kicking you and everything else. But there are some families who are very, very strongly, or feel strongly about this, and there's a lot of literature that would support it. When to worry, this is, when is this not just a sleep problem? If your child was sleeping very well and then all of a sudden isn't, there might be something going on. We think of a lot of different things. Reflux can make a child usually pain, reflux, an ear infection, maybe another illness that's coming on. So if they were sleeping just great and now all of a sudden they will not sleep 2-3 nights, they need to be seen. If they have loud, consistent snoring, if they're hyperactive during the day, there's studies that show that some of the hyperactivity of our school-age children is because they're sleep deprived. Or if they're excessively sleepy during the daytime, or they have anything that might look like a seizure to you, you need to see your pediatrician. And again, I mentioned that we do have a children's sleep center that's available. If you can't manage this at home and you've tried with your pediatrician and can't quite get this to work for you, we do have specialists here in our city who are phenomenally good at fixing problems like that. These are some of the resources. There's a whole bunch of books over here. You guys can take a look at them when we're done. But lots of different information out there. We tried to pick some of the ones that are probably the ones that we could definitely endorse. And maybe some of your pediatricians have talked to them about. There's one by Dr. Ferber, which I like most of what he says. My problem with it was that he seemed to think that parents who have sleep problems for their children just weren't effective, and I thought, well, no, wait a minute, I'm effective all day long. It's just one problem. So I didn't like his attitude. And then there's a bunch more. Dr. Pantley gives the no-cry sleep solution, and there's one for toddlers and one for infants. And these are some of the ones that are, if you're a very warm and fuzzy person and you want a warm and fuzzy home, she's got a lot of really great ways to help your children. Dr. Ferber's are a little more no-nonsense, this is what's going to happen, where hers are a little more slow-moving and change it maybe over a little bit longer time, but end up with the same result. And there's another one here. I don't know how many of you had children with colic, but we have the happiest baby on the block. That's also a very good one if your children have colic. Usually that's between 2 weeks, I think, and 2 months. And I think most of your children were a little bit older than that. Some of you who are expecting, though, might want to know about this book. If you're having, that's a completely different ball game. If your child has colic, you may end up throwing some of the things I've said today out of the window, because for a few months you're going to be doing whatever you can to get some sleep. But then once that's done, usually 2 to 3 months, you're usually done with colic. Then you need to reestablish all the things that I talked about. So hopefully by the time they're 5-6 months old, you can get back to a normal sleep routine. Does anybody have any particular questions today? Yeah, go ahead.
I do. I think you've covered a lot of topics, and I have probably several questions. One of them is our son, who's 3, has started to wake up kind of, and it's usually early on in his sleep, so I'm not sure if I view the REM, maybe it is REM because that's associated with dreaming. But he'll come in and say, I had a bad dream about mean witches. I mean, he loves the Halloween aisle at Target, for example, and loves it so much that he thinks about it, I guess, at night and is afraid of the mean witches. And so, what do you suggest? I mean, usually we just talk to him, comfort him. I tell him to punch the mean witch in his sleep.
Sounds good. And probably the big thing is to reassure them, comfort them, reassure them. Say, tell them, if they may or may not want to tell you about their dream. I wouldn't ask them too much about their dream because then they're waking up more to tell you about their dream. But I say, that sounds really scary to me. How about if I come and, come to your room? So I'd go to their room, put them back in their bed, and pat them and just say, I'll be right here. Or you go back to sleep, or I like that, you fix the witches the next time you see them in your dream. It gives them empowerment. I think that's good to say, it's not that it's just a dream, but it's a dream and it's not here. And sometimes for some kids, you have to check under the bed for the monsters. I think for my kids at some point, I told them that I had chased all the monsters out of our town already. So there weren't any monsters in our whole town. And they believed me. I don't know why. But, sometimes you can just tell them things like that. Well, okay, I will send all the witches home tomorrow. Something like that. But again, if he's really afraid of witches, I probably would stay away from the Halloween aisle. Because if that's what's causing it, I'd probably stay away. But you're right. Sometimes you can have someone who's who's going along fine and then suddenly has this problem. That's how I'd handle any nightmare. So I would make sure, though, that as they're telling you about it and very tearful and whatnot, you lead them back to their bed and reestablish that routine that they had going to bed. And for a real nightmare, you might have to stand there for just a few more than 2 minutes to just reassure them that eventually you need to get yourself out of the picture and get that child to fall back asleep on their own. If it's happening every single night, you have to decide about anxiety. And children, I mean, I don't think that this is a phobia yet, but some children have phobias, and that's an anxiety issue that probably needs to be dealt with in counseling first before they'll sleep well for you.